Can everybody see okay? Okay. Well, thank you for coming tonight, and welcome to the Tahoma Clinic. I'm Dr. Lauren Russell. I see many faces that I've seen here before, and welcome new faces as well. I want to just say before I start, I do have a bit of a scratchy throat. I ended up in the middle of December getting this thing going around, and I can't get rid of it. It just won't leave me. It's likes hanging out with me too much. So if I do cough, anything like that, I'll step away from the microphone and do that. But here's an interesting thing. It's very appropriate for our talk, the Slow Down Diet, because my plan, well conceived several months ago, was to get everything intact and ready, have experienced all this for you so I could tell you all the details. I clearly am not there yet with my own plan. I'm in the middle of it. But this particular bronchial thing that came along helped me slow down. It took me from a very rapid pace into one where I could barely do anything. And so that's kind of what I don't want to happen to all of you. I do not want life to hit you in the head and say, slow down. And that's more or less the purpose of the talk. This will be a little bit of a departure from some of the topics I've spoken on before. I've spoken on things like digestion, how to optimize nutrition, food allergies, cardiovascular disease, supplements, what to take when. So we'll cover some of that, but this will actually be a bit on the side of what to do to optimize health and nutrition, not necessarily one specific diet. Now, how many people here that they actually are trying to lose weight specifically? Okay, everybody. Many people are. I think we're all perpetually on diets. And so what I want to do, after having spoken to my patients over and over and having been asked this question multiple times, I'm asked, what is the best diet? What should I do? And the truth is, as many of you probably have found out, there is not any one optimum diet. How many people feel that they have the secret to weight loss and know exactly what to do? You're laughing. So I want to put that in perspective. And the reason I've titled this talk this way is basically the discovery of this book called The Slow Down Diet. I do really recommend it. It's by Mark David, M-A-R-C David. And basically the subtitle is Eating for Pleasure, Energy, and Weight Loss. But since I work with patients who have many different disorders, we do bioidentical hormone prescribing here. I work with folks with adrenal issues, other endocrine issues, thyroid, you name it. We see patients with many different conditions. Ultimately, and one thing I think is at core of many different disorders is our fast-paced life. You know, does anybody here feel like they're going too slow and they really need to speed up? Probably not. So essentially then what we're talking about is something that we all have in common here. And just to say what I've given you one page that covers some of the topics. Haven't given you a lot of room to write, but I've given you a couple of handouts. I've given you a diet guide that you can fill in later, and I think Devona then included some other handouts as well. So what I want to do is begin to have this discussion with you. I'm going to lay out a little bit of information for you now, and then open it up to questions that you may specifically have so that I can try to tailor it. I will say up front, everybody who comes here has phenomenal questions. You're all, experts in your own right. People who come to Tahoma Clinic really do follow many of the precepts that we live by here. And so if I don't have that answer to your question, I'll get it for you, or we'll find a way to connect you with the right person. So since we've all tried to lose weight, and let's say some of us haven't succeeded or succeeded the way we would like to, basically I can say that many folks have probably tried the quick fix diet. And I'm going to include a lot of diets in this. Basically, do they work? Well, what happens initially? Do you lose weight quickly at the beginning? Maybe, and I've even seen them on television lately recommending 10 pounds in 1 week, 2 weeks, whatever. What's happening is they're rapidly dehydrating you. You're losing water weight. But not only that, you're also losing muscle mass. And then when those of us, we diet over and over again, what ends up happening is we've lost muscle mass. Maybe we didn't replace it through exercise and strengthening. And we regain fat where we don't want it, and we lose muscle where we do want it. So basically the premise is diets do not work. And I really want to encourage you to think about a lifestyle plan rather than a diet. It'll take you farther and faster in the long run. So why don't diets actually work? There's a lot of different reasons, but some of the failure is really that we fail to put ourselves first. Now, I do work with patients who want to go on the HCG diet. It's a hormone commonly only found during pregnancy, but it is used in conjunction with a low-calorie diet. And there are many reasons and times to use that diet. It does help lower blood sugar levels, blood pressure, and it does result in a rapid weight loss. But what I tell everyone trying to do this is put yourself first. Do not go into this and try to do it tomorrow. Clean out your pantry, take away those things that are your gateway foods. We all have them. Maybe it's chocolate, maybe it's some other thing. I find wheat is a big one. So put yourself first. Set realistic goals. And I think sometimes we're afraid to do that, like if we're not there in a month, then there's something wrong with us. I think people really beat themselves up for not doing this perfectly. This is a life plan. We have a do or die attitude. It's like, if I don't make it, well, then the heck with that diet, it's not working. How many times have we done that? And again, I said the immediate results. You want a result right away. Sometimes we also sabotage ourselves by saying nibbling doesn't count, or how many of us have said there are no calories in ice cream, this is medicinal, things like that. So some of it is what we've learned, where we wish to go. But the truth is 95% of people who seek to lose weight regain it, and regain it with negative consequences. So one of the first things I want you to think about is we do not want to take in less food. We actually want to eat more food. And then with people who are starting that particular diet, the HCG diet, we have a loading phase. We tell people to eat more. To eat more is to actually lose more weight. And they don't believe me unless they don't do it. So the less we move, the lower our metabolism goes. The less we eat, the lower our metabolism goes. You can see that, and actually it's true that as we get older, our metabolism does decrease. So we want to do things to counteract that. And then why don't diets work? I just want to go through a couple of things. That we eat too rapidly. And then by eating rapidly, and we're going to go over some of the things to do about this. It destroys metabolism. It causes digestive disturbance. I see many people for reflux, gas and bloating. These are common conditions that I see. But what we're doing when we're eating rapidly, we're eating under conditions of stress. We're eating in a stress response, as if we're trying to consume our meal while we're running away from a bear in the woods. That's the fight or flight. We're running away, trying to then have our body respond properly. That is a situation that doesn't work for us very well. It decreases our ability to burn calories. We don't absorb nutrients into the cell itself, and ironically causes us to eat more. We eat more because we want the good feelings that the food brings, but ironically, we can't get the good feelings until we start to slow down. Does that make sense to you? Okay. um, ironically, in a diet, you actually want to eat more, and we'll talk about what types of things you want to eat. So when we eat in situations of stress, just think about running away from a stressful situation. Are you breathing kind of calmly, relaxed? No, you're hyperventilating. You're speeding up in terms of your breathing. You have toxic emotions from that situation. Let's say you're driving to work, and let's say you're eating a breakfast sandwich, something like that, and the guy just cut you off in front of you. How do you think that's going to go into your stomach? We all know. I know you know these things, but I want to cover them so we can talk about what things to do about it. And then on top of it, because we're not eating in a proper way, then we add in things that reduce the digestive disturbance, the pain. Sometimes we excessively exercise because we did have the chocolate cake for lunch.